Jenna, thanks. According to the American Cancer Society, when breast cancer is detected early in the localized stage, the survival rate is 99%.
The earlier it's caught, the better treatment options there are, including breast-conserving surgery, where only the cancer and surrounding tissue are removed.
Great progress has been made in breast cancer treatment with a focus on targeted therapies, drugs that zero in on cancer cells, along with minimally invasive surgeries like a lumpectomy, where only a portion of the breast is removed.
We've come a long, long way. When you think that, for almost 100 years, we were doing a radical mastectomy, removing the breast, the muscle, the skin, all the lymph nodes, which was disabling, debilitating, and disfiguring. And now many patients with breast cancer are able to have a small lumpectomy, take some medication, and actually that may be it.
Dr. Holly Mason, surgical oncologist at Bay State Health, tells Western Mass News typically women under 70 who opt for a lumpectomy also receive radiation to kill any stray cancer cells that remain. As treatment improves, so do rates of recurrence.
Where the great strides really are the risk of distant spread, so recurrence elsewhere in the body. And as our medications get better, as our medications are more targeted for the individual tumor, those recurrence rates are lower, survival rates are getting better.
Rates of local recurrence, the cancer coming back in the breast, are improved too. With a lumpectomy and radiation, there's a 4 to 5% chance the cancer will come back in the breast over 10 years. With a mastectomy, there's only a 2% chance. The earlier cancer is found, the less treatment you'll need. But the pandemic disrupted preventative care, including mammograms, and Dr. Mason is seeing the adverse effects.
We're still seeing patients who are off schedule by 2 or 3 years because of the pandemic. And unfortunately, we are seeing some larger tumors because of that.
Dr. Mason says those who are diagnosed with breast cancer should build a strong support system, ask their cancer team questions about their treatment, and above all, advocate for themselves. But she says there is good reason to remain hopeful.
I always tell my patients, I use the term tools in a toolbox, and we have so many more tools now than we did when I started back in 2000.
If you have a family history of cancer, you may have a genetic risk of developing cancer in the future. Bay State Health provides genetic testing if you're referred by your provider.